The active discharge management system that Tefen assisted us in implementing was a huge success because we thought we had done everything we could possibly do so far. They came in and they provided a statistical analysis, and we provided the resources to initiate the changes to increase or expedite our throughput processes.
Our system did not provide us with an accurate picture of what was going on with our patients. We did not know if the patient was discharged, what activities needed to be completed, and in addition, we had patients staying in rooms for extended periods of time after they were clinically discharged. Working with Tefen helped us to improve our processes, looked at all the other departments that were involved, and helped us to establish time frames that all of the activities needed to be performed in. With the admitting and the discharging of our patients at the same time, it provided a chaos in our atmosphere that we began to just think was normal, when in fact was very abnormal and causing a lot of overtime, having patients placed in rooms that were not desirable, meaning that they were in rooms for their entire postpartum stay without a private bathroom. The hospital sought Tefen's expertise by, first of all, seeing them at a CWISH conference last year and hearing the accomplishments that they had worked with another hospital. Our Vice President, Tricia Johnson, was there and spoke to them about the possibility of coming to Women's Hospital to assist us with our throughput issue. We reached our maximum capacity with beds. We were having patient, staff, and physician dissatisfaction, and mainly due to having to bring patients to the areas of non-desirable rooms. In the past, the hospital has handled this type of process by using interdisciplinary teams, but as we've mentioned before, we thought we had pretty much done everything that we possibly could. We have had experiences in the past with consultants who came in and wanted it done their way and not understanding our culture, understanding the ways that we do things here. Tefen was able to come in and really understood our business, the organization, and pretty much the culture.
Nurses are now more empowered by the system that Tefen assisted us in implementing because they now have a reference as far as a time range is to complete many of their nursing activities prior to discharge. Prior to the changes that we implemented with Tefen's assistance, there were no hard schedules in place for many of the activities that were being completed. Such activities include the hepatitis B vaccine administration, car seat tolerance testing, the PKU metabolic screenings, and things of that nature. Now nurses are more empowered because not only do the patients have a patient itinerary that's computer generated, it gives them the expectations and makes them more active participants in their plan of care, but the nurses are more empowered as well to complete these activities in a timely manner.
In addition, Tefen has assisted us with enhancing our bed board capacity, and we are now able to visualize the beds and see exactly if the room is clean, dirty, or occupied. With an occupied bed, we can now tell what activities are left for a patient to have. That activity is not done in that specified time frame. It'll send a critical or overtime warning to the department that's responsible. The charge nurses are able to visualize the bed board and see the activities that are left to be performed, and they can communicate with the other departments to find out what is the holdup and prioritize our patients for discharge. In addition to that, everything that we did before, all of the checking on the patients, checking to see who was ready for discharge, what needed to be done, was a very manual process. It either involved the charge nurse calling the units or the departments, or actually walking around, and we have patients on 3 floors. So it was a lot of manual walking, calling, that type of thing. Now it is all visualized on the bed board, and it can be looked at from any PC that is on our units.
The discharge management system has made a huge difference in our processes in the fact that it has assisted us in identifying the processes that needed to be completed, Again, we were able to put those into a specific time range to be completed on the patients based on delivery date and time, and also the type of delivery, whether it be a vaginal delivery or a C-section delivery. Tefen was able to provide us with statistics that showed that we were able to decrease our C-section length of stay from approximately 79 hours to roughly 71 hours, which is huge for us. And that makes a lot of difference in our bed capacity and not having to overflow patients to less desirable locations. This is really significant since we do have approximately a 40% C-section rate. In addition, we've noticed a big difference in the empowerment of nurses in having more power over when certain tasks should be performed, and also it's really involved the patients in their plans of care and knowing the expectations of when activities should occur.
And the active discharge system has been an awesome process for us to go through. Working with Tefen has assisted us in taking Women's Hospital to a higher level. We've raised the bar of our expectations for ourselves. We're now able to monitor our process and progresses. In addition, we're now able to see key performance improvements, which we call KPIs, to see the activity of the departments and our success in reaching the activities in which we have defined for our patients. From this point on, we will continue to monitor our process and progresses and continue to make changes as we see fit.